Guys, we're in the middle of a pandemic and these are trying times. It's hard on our mental health, our mental state. And this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Podcast Nation. Great episode we got here with Dr. Tony Hampton. This man is legit changing the boogie, people. He has set up programs in marginalized communities, areas of color where there are high diabetes rate, high obesity, high hypertension, high type 2 diabetes levels. And he's changing the boogie through multiple programs, healthy living, food smart. You're going to hear about all these programs that he set up using principles of low carb, exercise, keto if needed, improving sleep, dealing with trauma, like all these aspects of health that are so important. And he just addresses this. And I'm so proud of Tony, a leader in this community. And as I mentioned, boogie changer. You'll have seen him on Diet Doctor. That's where I got introduced to him. I saw him on the Diet Doctor podcast. And I'm like, we got to get this cat on the show for real. So we'll jump onto it in a second. I just want to make sure y'all know about Solving Wellness, our online platform addressing clinician burnout, where you got your workouts, you got your nutrition tips, you got your yoga, mindful meditation, all in one platform, all in one community. Go to solvingwellness.com and check it out. So without further ado, Dr. Tony Hampton. Quadcast Nation, listen, we have a spectacular episode today because this is one of my favorite human beings. I got to appear on Dr. Tony Hampton's show not that long ago. And this man is an innovator. He is a man that is changing the boogie everywhere he goes. So Tony, welcome to the podcast.
Man, I'm so happy to return the favor and to, absorb some of this good energy because on a mission, man, to make all of us metabolically healthy. Yes. And that's why I said, call me the metabolic health doc, because I know that's the secret to wellness, and I don't need to do medicines, procedures, and surgery. Sometimes, but not most of the time. Most of the time we can heal. So I'm just happy to be part of your platform to help spread this word. And we got to reach as many people as possible. So thank you so much for having me, my brother.
Absolutely, Tony. Absolutely. And I just want to get a bit of background into your story on the why. Like what motivated you? Because when, we talked about on your show, like for me, it was COVID that really spurred the willingness to talk about people's metabolic health. But what got you into this landscape?
It's really two reasons. One was my lovely wife, Karan, who she's a pharmacist, and she got hit out of nowhere with this type 1 diabetes diagnosis. And I really didn't feel that I could help her like I wanted to. So I started my dive into, well, how do you help people with diabetes from a more natural perspective? Because even though she was a pharmacist, she wasn't excited about being on medicine forever. So we later learned that if we treat diabetes with lifestyle, even though she was type 1 and she would need insulin, her insulin burden would be much less. And we all know that too much inflammation from insulin can lead to obesity and other metabolic problems. So that was what kind of really kicked it off, trying to help my wife. The second thing was the recognition, as I kind of did research for her, that most of my patients were suffering from obesity. And so I was like, well, what do I do about this obesity thing? And of course, I was still thinking, as we all did, eat less, move more. But I was finding that I couldn't move the needle. And I was a vegetarian for a minute, and I was trying that. I couldn't get the community I serve, which is a community of color, to engage in this vegetarian lifestyle. So luckily for me, the luck had it. YouTube and all these other places like Twitter, I'm learning from other people that there's another way. So I learned that other way. And the other way was I can use lifestyle to not only help my wife reduce her insulin burden, but I can also use it to help my patients. And once I shifted from disease management and symptom suppression to healing and reversing disease, it was like a miracle in my practice. A miracle. And every day, even today, as I talk to you, we celebrated some successes. People who had, at least 4 or 5 successes in a morning clinic session, lost, anywhere from 10 to 50 pounds over the last year, and getting off of medicine. And it's like, what a way to practice medicine. Patients are happy. I'm happy. And hopefully the health system understands and values this, and they should be happy because we've reduced the cost of care.
This is exactly it. And number one, I just want to give some love because you're doing this in a community like our people, like people of color, often are hardest hit when it comes to, like diabetes, obesity, hypertension, and often are looking for a way out. Yeah. We're looking for a way out and like a lot of these interventions, it's hard to do when you're not always making ends meet. It's hard to take the time to go. You're not affording a gym necessarily. You're not necessarily affording the highest quality foods and whatnot. So to have a physician in the community to offer a sustainable and legit way out and just act like a role model to really show the trail, the route out of these metabolic diseases. It's so beautiful. It really is beautiful, Tony. Because, like I said, this is sustainable. So, just give us a sense, like how you went about this, because there's a lot of people that we know what the problem is. We know, like we want to improve people's metabolic health, but the question is how. How do we create this at scale? So, what have you been able to do in your practice?
Well, some of it was being fortunate to work with leaders that are hearing you, right? So, I was fortunate in my role. I'm currently a regional medical director, so I kind of lead physicians, and of course I'm a doctor in practice. But before we had a merger with Advocate in Aurora, we had a Advocate operating system, and that system had a vice president who was really open to hearing a clinician's perspective. So he asked me, what is it that we need to do? And having taken my journey already with what I was doing for my wife and what I was doing for my patients with obesity and diabetes, I said we have to value lifestyle. So it started there, and what we ended up doing initially is we started what we call the Healthy Living Program, and we had a really great team that included all aspects of healthcare. We had people who were a physical therapist. We had nurses, a clinician like myself who's a doc, pharmacists, different specialties, and they all kind of made a contribution. So whenever we put these events together where we would, get in front of 100 or 200 people, we had everybody's input. And we also made sure that the teams were diverse so that when people listened to us, they could, it could resonate with them and they could be relatable. So the first thing we started doing is that type of program, getting in front of people in partnership with the Chicago Food Depository. So I'm in Chicago, and the Chicago Food Depository, they know food and we know healthcare. So we partnered and we did a team sport. But we also had to tell them, we need to see some cauliflower. We can't have, potatoes as an option when people are diabetic. So we partnered with them. We also we went into the community and we talked to the grocery stores and said, hey, there are some things that we're trying to move in a direction of that involves less starch, sugar, things like that. Are you willing to bring some of these things into your store? So we talked to them. We got a feel for the food deserts and what people were struggling with. And that helped us it's hard to tell people to eat something if they don't have access to it, right? So we did that. And that program actually moved the needle. We actually were able to show that outcomes did improve by doing that. We were able to, and reduce the number of medicines people were taking and reduce their weights and BMIs. And so it really did show value. So sprouting from that program was smaller programs. What we found is that the large groups are great, but sometimes you need smaller groups. So we started to do things like the diabetes prevention program, same model, although we tweaked it a little bit because anybody that knows me knows that I'm not a big, I believe in carb reduction to a certain extent in patients who are metabolically unfit. So we tried to tweak it so that it would meet that methodology. And then we also was able to, we still do that. And we have a COPD program. A lot of people say, what does, chronic obstructive pulmonary disease have to do with your diet and all of that, everything. So if you improve everything, right? So we have a COPD program. And that program, again, smaller groups, maybe 10 to 15, they get to know each other. They become accountable to each other. And all of a sudden, less inflammation. And maybe my COPD won't flare as often. The health system should love it because that equals maybe they won't end up in the emergency room unnecessarily or in the ICU where you hang out unnecessarily. So it's really a great opportunity to use that model to teach. And then we took it to the next level. We started a food pharmacy. We spelled the pharmacy with an F instead of a P. And with that, we allow people to come into a couple of our hospitals every, a couple of times a month to get food. But when they come there, they have to consume information and we'll give them a recipe. So how should I make this cauliflower if I'm not accustomed to making that, or the eggplant or so we explain things to them and give them foods that we feel will keep them metabolically healthy. And we have a person who is a nutritionist there, and we'll have somebody like myself there. And we kind of put them through they have to go through a couple of tables before they get to the food. Now, of course, when the pandemic kicked in, we had to do more of a drive-by and we would just hand them information. But man, I tell you, it was a great opportunity to help people deal with that. And so that's kind of where we took a lot of these concepts. More recently, we're working on a weight management program. We've already established it. And what's cool about it is that most of the doctors who are working in that program, they understand metabolic health. So if you say to them low carb or keto, they don't look like a deer in the headlights, right? They get it. There are people who do surgery, bariatric, and they have frontline clinicians like myself and others who are on the team. So we're trying to but we're very strategic in that we use metabolic health because we don't want anybody who's a vegan, vegetarian, feel disengaged, because that can work for a lot of people. So what we do is we say, but we also don't want to put people who are carnivore or keto in a bad spot either. So what we say to people, whatever it takes to help you become metabolically healthy, we'll do that. And I think that that's what we've been able to achieve. So when you think about other tools we'll be using, like an app to help people, and we can talk a little bit more about that. Food Smart, a partnership, we'll use that technology to guide people towards a program that works for them, because you don't have to be low carb to be healthy. It's just that I tend to lean that way because in communities of color, particularly African Americans, there's some carb intolerance that we have that's beyond what our peers have. So if that's true, then we need to first let people know that that's a real thing. and then find ways to honor their culture with the foods that they're familiar with, while also honoring the fact that if they eat too much starch, it can harm them. And that way we can have, future generations of healthy folk to continue to spread this message. So that's kind of where we are. And I'm really excited that I'm in a health system, Advocate Aurora, that actually will listen. And our motto is we help people live well. And I challenge them, say, well, what does live well mean? Does it mean taking a statin, or does it mean helping you to heal? And helping you live well doesn't mean you're compliant with your medicine. It means that we find ways to get you off your medicine.
Preach. Getting people off their medication. I love it so much. And I don't even know where to start. Like in terms of even, when it comes to healthy living, the fact that it's so multidisciplinary, right? Like multiple disciplines, allied health, physiotherapists, nurses, MDs, pharmacists, all coming together to try and influence individuals into healthy choices. I mean, it's brilliant. And what I love about it too is like this recipe that you've come up with is scalable. It's people throughout the, North America could implement something similar. And
that's right.
And so let me ask, and before I forget, also, I have no doubts, Tony, like everything you're saying, whether it's a COPD or diabetics, that this will ultimately save dollars. This will, without a doubt in my mind. You prevent somebody, for example, a COPD patient from landing in the ICU. That's $3,000 a day, like conservative estimates. So
right,
it won't take that many people, preventing too many admissions to really show value. But my question for you is, what is it? Like, what's some of the details? Like, I like the way you say, like, you try and tailor the approach for what the patient is ready for. Like, you're really trying to harbor success, right? Like, that's why you're not saying it's got to be low carb for everybody. It's vegans are welcome. Like, there's a bunch of ways that you could approach this. But what are some of the key principles? Like when it comes to either movement, when it comes to diet, when it comes to socializing, like what are some of the key principles that you're thinking about?
Yeah, it's actually, I've simplified it in my clinic, and I've simplified it even with the podcast, Protecting Your Nest. And that was all born out of answering that question, right? So in my training in nutrition and functional medicine, I learned about the root causes of chronic disease, right? And I learned that the root causes included, and that's the nest, of poor nutrition and eating too much. So I'm an intermittent faster. So if we're recording this in the afternoon, right, I have not eaten yet, and I will eat after we record, but I'm not hungry because my body is adaptive to eating that way. And then the E is for the exercise. So when I talk to patients, I don't worry about exercise in the beginning because they may be 350 pounds. I just tell them that is going to be how we're going to maintain weight loss. So we talk about being metabolically healthy with exercise. Then we talk about the stress and the sleep. That's the S. And we talk about where are you now? And what I do as I go through this list, right? The T for trauma. Have you been traumatized? Is there something that's bothering you more recently or something from the past? Do you think in a positive way? And then the rope in the NEST and rope acronym, relationships, avoiding organisms. I'm going to get one of my buddies who's a doc in HIV to come talk about the PrEP, that something you can give yourself if your lifestyle is such that you're concerned about HIV. Well, there's something to take. People need to know about that. And then the P for pollutants. I'm writing an article with the diet doctor. We're going to talk about pollutants and how to avoid them. And of course, the E for protecting your emotions and your life experiences. So what I do in a clinical setting is I make awareness of all of these things. And then I say, let's see where you have gaps, because I can't help you with a diet approach or a way of eating if you're still in trauma. If you're in a dysfunctional relationship and everything I say to you will then get sabotaged by your partner. I can't help you. If you're emotionally unstable and you are struggling with your emotions, whether it's anxiety, maybe it's from your supervisor at work, I can't help you, because they'll sabotage everything. So that's kind of how I approach it clinically. That's the way of thinking I try to speak to the world about. And the goal is to help people. We grab them by the hand and we help them problem solve. We say, let's see where you have gaps. We're going to eat the elephant one bite at a time. We're not going to build Rome in a day. But they need coaching. They need somebody to give them information that's valuable, and then to coach them in a way, after you build rapport with them, that they will honor. And we let them help solve their problem. In other words, this is where you're struggling. How do you think we can solve that problem? When would you like to get started? So I start with them. And if they're, not sure, I'll give them tips. But a lot of times they already know. They just need somebody to kind of make them accountable and to coach them along, and to also give them something that's realistic. And again, going back, honors their culture, honors their, you can't tell people to stop eating what they've been eating for 70 years. What you do is say, what part of that is going to work for you and what part won't. And it's okay to remove some of the things that are causing harm.
I love that point too, Tony, about the realistic goals. Like, you got to work with them, like what is actually achievable, like not a Hail Mary. You got to be like, give me that 3-yard pass. You know what I mean? Like that, right. Like just get moving in the right direction. A little bite of that elephant. I like it.
Yes.
So
yes.
We didn't talk about this before, but I'm curious. Like, I love, number one, dealing with some of the trauma, some of the existential, emotional side. Obviously, is super important. I'm curious in terms of when you make some exercise recommendations, for example, what are some of the principles that you look at? Yeah,
I definitely, I have a lot of seniors, so I try to keep it simple. So I remember when I first started this journey, I would, talk about squats and push-ups and, lunges. But then I realized a lot of my seniors, they may struggle, right? Mm-hmm. Arthritis kicks in after years of overuse. So what I've done more recently is I tend to implement the ideal of using those elastic bands, right? Oh. So I absolutely have found that that's the secret, the elastic band. So what I tell patients is this: I will give you an exercise. Now I did grab some knowledge from one of my previous guests, and that's Dr. Ben Bokikio, right? And I told that, so I listened to what he does, Dr. Ben Bokikio, and what I found is that what he does is okay. Yeah. So what I found is that what he does is he has a 15-minute program that you do twice a week. Mm. So if you grab an elastic band, put it under your feet, and you just laterally raise your arms, and you do it at a level where you can do it, but it's hard, right? And you only can do about 40, maybe like a minute and a half of this max. And then you go to the next body part and you do the same thing. What I found is that most of my older patients, and that's actually what I do now. In 15 minutes, I can cover the 7 exercises that does the entire body. And what happens is, what we don't do very well, and we learned this from sports, how some of our athletes, they're trying to get these guys back, so they don't give them time to recover. And what we find is that if you don't let the muscle heal, recover, and grow, then you're not going to be successful. So a guy like me who was exercising every other day for an hour, now I'm doing 15 minutes twice a week. I also stretch, and I'll be walking as the weather starts to change. Mm-hmm. I find that it's a bite-sized piece that people can handle. People don't believe it's going to work, but I'll go as far as show them the studies that show that it works. So that's kind of what I recommend for exercise, because again, I want to keep it simple, bite-sized, realistic, And it's rare that a person can't do 15 minutes twice a week, but it has to be intense for 15 minutes. But once you're done, and your mind can handle 15 minutes. Your mind going to the gym, getting dressed, and you can do these things in the gym, but it's just easier just to have those bands at home.
100%. I love it. Once again, just working with your people, hearing what will work for them, and making it achievable and getting results. So valuable, Tony. So valuable.
Yes.
Another one that I always like to pick on MD's perspective. What do you when you have patients that are struggling with sleep? I know it's a big topic, so you don't have to get into the weeds, but just maybe some of the high level advice that you're often giving your patients. Yeah,
well, it's the same advice I think we give each other, right? Like, what we don't want is a doc who hasn't been getting sleep. You know, it's so funny you bring up sleep because I'm doing an experiment. I think A-Day Fox, the Black carnivore, who has her own YouTube and podcast.
Oh, yeah. I showed up on that once. Yeah.
A-Day Fox, man, I love her. And she took a break from coffee, right? Now, I am a proponent of coffee. Let me say that first. I think coffee's fine. And she was doing it for a different reason. But when she started talking about it, I said, amen, right. Coffee is actually good for you in more ways than anything. I said, you know what, but I felt like I needed it, right? So I said, you know what, let me see what happens if I just get my 7 hours of sleep. I always tell people somewhere between probably 6.5 to 8 hours is a sweet spot based on the studies I've seen. So I started my journey without coffee, and I found that as long as I get enough sleep, I don't need it. So that's the first thing. Number two, and the reason why that's important, because a guy like me, if I get too much, then I'm not sleeping well at night. So it's like, you have to end it at a certain, we always tell people, at least by 2 p.m., at least be done by then, and sometimes that's still too late for me. Mm-hmm. But when we dive into the weeds a little bit, I say to people, consider a nice shower at night. And then you'll, get into a cool room because you just showered, your body will feel the difference. Mm-hmm. I'll encourage them to, even if they want to go to this level, get the blue blocking glasses, because man, if you put that on at the end of the day, for an hour or so before you go to sleep, you're preparing your body and you're getting your melatonin levels right. And I just think that's huge. And speaking of melatonin, which you want to be high at night, in the morning, you want your cortisol levels to be up. And so I'll put that, I have a mood light. I think it's by Philips. It's just an example. So get that light in front of you in the morning so you can get that circadian rhythm. You're kind of training your body to do that. I'll tell them to, obviously that screen time, which goes back to the blue light. Let's read something at the end of the day instead of, thinking about watching that computer, which is so hard. We'll talk about, we talk about melatonin, but we're always cautious. That's why I like the blue blocking glasses, that they don't your body gets a little lazy if you externally put it in your body. So maybe in the beginning to get your rhythm down. But magnesium has been a big fan of my patients, and a lot of them will use magnesium cream or something by mouth, especially the ones who are trying to be regular. They like the one by mouth. So they'll do that as well. Obviously, darkening the room with some dark shades. That's every time I go into a really nice hotel and it's really dark, you can feel the difference, So I tell people, you may be doing some of these things already, and I'll give them a list of things to consider. I know Sean Stevenson wrote a book, Sleep Better. Sometimes I'll recommend that book. But I say, let's look at some of these principles. Let's fill some of the gaps. You don't have to do all in one day. But I guarantee you, something as easy as don't eat too late because your body's digesting, and let's work on some of these principles, and I guarantee you, you'll start to feel different. And if you don't sleep well, you're going to increase your cortisol hormone at the wrong time, and that's going to end up leading to too much glucose floating around. That's going to increase your risk for obesity. If you don't sleep well, your blood pressure may be, I've seen studies where your blood pressure is high for 12 hours after you wake up because you didn't sleep well. So you're going to come to my office, your pressure is going to be high. So I try to give them little nuggets of information that they may not be aware of. And then we find, as is in the rope and nest, where do you have gaps? Where can you do better? If we need to go to medicines, that ends up being the last option, only because it's not quality sleep that you're getting with the medicine. So it's okay, particularly as you're transitioning, but it's not the answer. That's why we're not afraid of medicine, but we recognize it doesn't solve the problem. The problem is, do I have a lifestyle that's going to let me sleep?
Yeah. You hit on all the golden points, my friend, but it's just a nice reminder for people too, because, the more you hear about it, the more it's reinforced. But the sneaky one that I introduced is the blue Balkan glasses at night. My wife introduced me to that. And that, to me, I feel like that's been a game changer.
Yeah, they always, they add so much value, even when you're not looking. our significant others, they really add value. And I'm glad she did that for you. Absolutely.
Listen, Tony, the one thing I want to touch on, this is Black History Month. And, I could speak personally as a guy that's been going in through more and more leadership positions and really seeing very little of us represented at higher levels. What does it mean to you being a Black leader in your community, in the medical field? What does that mean to you, and what's your experience been like?
I'll again say positive things. I've been fortunate to, before we merged, we had a diversity and inclusion committee, and we didn't just talk about, communities of color. We talked about gay and lesbian issues, et cetera, and just even people who are dealing with, blindness, or, how do we serve people and honor them for who they are. So I'm fortunate to be in a health system that is making diversity and inclusion a priority. And literally a meeting I had this morning for the quality committee, we talked about how with patient experience, why is it that the patient experience may be different for a person of color than it is for some of our Caucasian patients, at the other hospital. And some of it is perception. In other words, how I perceive myself, how I think the system's going to perceive me. And some of it is reality, right? There are times when we can do better. And even me and you, even though we have dark skin, we have to catch ourselves. I had a patient just yesterday who, if you literally a guy that you had a little edge to him, kind of, got a little street look to him, right? Mm-hmm. But how do I approach a conversation like now? It's easy for me because I grew up in a neighborhood where that was the norm, a guy like that. But I still have to be thoughtful about how I approach that conversation because he's already been beat up by the time he's come to me. Society has already told him he's less than. So I have to be able to, and if you listen to this guy and listen to his words, and he may even be hearing this podcast one day, because he listens to my podcast, interesting enough, he will tell you some stories that'll make you understand why he gets angry sometimes, why he's down sometimes. And you can't have lived in his skin and not have felt that way or thought that way. So for me, being in a leadership role, again, if I'm helping to lead our quality committee, or if I'm a regional medical director, it's my responsibility to not just be in a role where people see diversity because of who I am, but I have to bring these issues up as things we have to address. So us talking about how our people of color are doing surveys differently than other communities and other groups of people, that's a win, because that's the fact that we've been talking about it. I can tell you, you go back 10 years when I started my journey in leadership, those are things that we didn't really talk about. We did have a diversity and inclusion committee, but within a separate committee unrelated, and we're talking about that, is unheard of. So my goal is to put it in front of people. And I think anybody listening who is from a background, I don't care if you're Irish or Polish, it doesn't matter. It's important that we put our diversity in front of people and be proud of it. And it is that makes us shine, because there are so many things that I've learned. I remember, this is the last thing I'll say. I remember when I took some classes in Vermont, and in that group of students that came from my school to take a microbiology class, there was a young lady from India and a young lady who was from New York. And she was tough. She was every stereotype of New York, trust me, but she was Jewish, right? And I'm sitting here thinking, man, my struggle is, you guys don't understand my struggle, right? And then the Jewish young lady was like, well, I'm still dealing with some stuff that you wouldn't think a person with my skin tone deals with, because I'm Jewish. And then the young lady from India told me some stories that I couldn't believe. So I think if we can open our eyes to seeing the world through the lens of others, it'll help us to then not only be able to tell our stories better, but be able to understand that there's struggles. Everybody has a struggle. The key is, how do we work together to make the world an easier place to live in? And if we get to just a little closer, we're not going to remove racism, because the babies of racist people are being taught by those people as we speak. But we just want to move towards a world where it's less of that and less of that, and where we actually can address those folk in a way that honors everybody in society. And I think if we can get to that point, then we would have won, because again, I think it'll never go away, but I think it'll be so much better. I mean, when I watch TV nowadays, 'cause I don't watch a lot of TV, but I've been watching a little bit more lately, I'm shocked at what I see on TV. We're really embracing a lot of things that we hadn't embraced, whether it's diverse, mixed couples, right? Mm-hmm. You didn't see, I mean, it's like you may see a mixed marriage more than you see a marriage that's not mixed these days. That's a huge jump for it. You may see gay and lesbian issues being addressed in a way that you've never seen. So I think we're making progress, but we can't stop fighting, because it's going to always be a fight.
This is so well put. And I know it's something that, post George Floyd especially, I feel a lot of us have been motivated to be a voice. And Tony, you've been doing an incredible job of being an advocate for our people. And, I lean on people like you to just continue to fight the good fight. And one thing too, that this is something that I've struggled with too, is like when you come in these positions, bring your whole self. You don't have to fit in some kind of, you don't have to be that token, brother. Like you could speak your truth. You could speak from your perspective, because I'll tell you, when you do it, like, that's why you're there. Like, to be able to do that advocacy, you need to be able to put in your 2 cents, even though it might ruffle feathers. And, I always say, it takes like a couple seconds of courage to bust that out sometimes. Just, yeah. You be like, you got this. But
once you do it, it's easier. Yeah. And people are very curious about you. Like, you'd be surprised. People are curious and they want to hear that. And then you can't be afraid to not you got to be comfortable being uncomfortable. So I always use the example of Luther and Barry Manilow, right? Luther Vandross and Barry Manilow. So I just always remember being in a setting where I was the only person of color, and they were talking about Barry Manilow. And I didn't know anything about Barry Manilow. I mean, I knew his name, but I never listened to his music. I listened to Luther when I was a kid all the time.
For real.
So instead of me being uncomfortable, and I was very conscious of this moment, I said, tell me more about Barry Manilow. Is that like Luther? And I just, I was like, tell me, he writes love songs, So I think be comfortable not fitting in, but your curiosity will help you fit in. Ask questions. Yeah. And then share whatever it is about you that reflects that conversation. So I think that'll help people. You do not have to fit in. You just have to be yourself, be Tony, and then you're fine. And once I got to comfortable being myself, even my wife says, your corny jokes, I said, I'm going to keep cracking my corny jokes because that's who I am, and I got to be comfortable with that. So I think that's it.
Oh man, so well put, Tony. So well put. Listen, this has been an absolute pleasure to be able to spend this time with you. And I want people to get as much of Tony Hampton content as possible, protecting your nest, anywhere they can find you on Twitter and Facebook, YouTube. So where can they find you?
You know, it's so funny. My brilliant son, who's at WashU, he's ending his master's program this year, and I got another brilliant student, my youngest son. He's at WashU, but he'll be a senior graduate. So I got 2 graduates, right? But my oldest son was like, dude, Linktree. I was like, what's Linktree? You know, this just happened like a week before this recording,
That's
right?
funny. I'm about a week into it too. I just found this out.
Yeah, I'm like, I don't know if it's been around, but my son's
been around.
So that's what I would say. If they just search Dr. Tony Hampton Linktree, all the links will be there to everything I'm doing. And I encourage you, if you're leaning towards low carb, to try it. I have a video on there. It's how to adopt a low carb diet. I do articles with the Diet Doctor every month, so you can check that out. And those links will be there as well. Work we're doing with the Society of Metabolic Health Practitioners, led by Doug Reynolds and Pam Devine. That's really a great resource as well, because if you're looking for a doctor like me and Dr. Kyeremanteng, hey, listen, they're out there, but you may need a resource like the Diet Doctor. They have links to clinicians, the metabolic health practitioners. They have links. I would encourage people to check that out. But it's all about spreading the message, guys. And that's why I share other resources so that people can find a nice sweet spot for themselves. So thank you for allowing me to be here, my brother, because again, we got work to do. We're probably going to go see patients after we record, but this is the gift of getting in front of this mic, talking, sharing, and then going to see real patients and dealing with their needs. I feel so gifted to be in this profession. I just couldn't have chose a better profession.
This is a great spot to end off there. Thank you so much, Tony. And you know we're going to be connecting soon, my friend.
Oh, no doubt about it. You do your thing, and thank you so much again.
Thank you. All right. Thanks so much for joining us. You can find us on Instagram, YouTube, TikTok, Facebook, Twitter at Kwadcast. Leave any comments at kwadcast99@gmail.com. Leave that 5-star rating, yo. Helps with the visibility of the show on iTunes or Spotify. Just want to thank everybody again for listening. It means the world to us. And we'll connect again real soon. Peace.